afternoon, everyone. You are very welcome to today's event. The panel will be delighted to receive any questions that you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using any other device today, you may find this feature located in the More section, usually identified by 3 dots. Now, without further ado, I'm going to hand you over to your fabulous host for today, Larkin Brennan. Thank you.
My oh my, Jean, what an introduction. How will I live up to that now? Let's go for it, as I say. Hello, everybody. You're really welcome. It's Larkin here from the Men's Development Network. I'm delighted to welcome you on behalf of all our team of partners again for International Men's Health Week for 2026. Of course, you know who the partners are. We have the HSE and the Men's Development Network and the Men's Health Forum in Ireland. And we also have SETU as well, who are with us there in the background. Thank you so much for choosing to come with us today for the next hour, just to mark the week. I have with me as well, of course, Michael Feeney. Michael minds me here, Irish Sign Language interpreter in English. And he's here with us today to continue spreading the good news for the next hour or so and making sure that we get to so many people across our nation and beyond. Now, this year is really flying, folks. It's really flying on us. We're in the middle of June again. We have a World Cup going on. We're still in the middle of exams for some people, and we have International Men's Health Week. And through the engagements of over 100 partners plus, we're here today under the wise banner of one step at a time, progress, not perfection. And to start us off with the first step and to begin our webinar today, we welcome you to watch a short video, which was by the Minister of State with responsibility for public health, well-being and the National Drug Strategy. This is Minister Mornane.
Today marks the start of International Men's Health Week, which runs from Monday the 15th to Sunday the 21st of June, ending on Father's Day. Ireland is joining with countries across the world to focus attention on the health and well-being of men and boys and to encourage practical action that can make a real difference. I want to acknowledge the work of Men's Health Forum in Ireland and the wider All-Ireland Planning Group for Men's Health Week. They have drawn on knowledge, insight and expertise of over 100 organisations. The HSE has been closely involved in this work and my department is pleased to support such an important week. The theme for Men's Health Week 2026 is One Step at a Time. And we know improving health doesn't always begin with big changes. It begins with one small realistic step and then another. For some, that first step might be as simple as booking a checkup. For others, it might be getting more active, improving sleep, cutting down on alcohol, stop smoking, or taking the step of talking to someone you trust about how you're really doing. We know that men continue to experience poor outcomes in a number of important areas of health, whether the issue is physical health, mental health or well-being. Men are less likely to seek help early and often delay using preventative services. This can be due to factors including social expectations, work pressure, caring responsibilities, rural isolation and deprivation. Men's Health Week is really important and Ireland has played a leading role internationally in recognising this. Ireland was the first country in the world to publish a national men's health policy. And that leadership continues through Healthy Ireland. Men 2024 to 2028. This provides a clearer framework for improving the health and well-being of men and boys and my department is committed to supporting the work of the HSE and the Healthy Ireland Men National Implementation Group and other key stakeholders to improve men's health in Ireland. Practical action is already happening across the country in communities, workplaces, farms and sports clubs. Men's Health Week is an opportunity to build on that work and to reach even more men with messages and supports that are easy to act on. Men's Health Week is not only for men. Families, friends, workplaces, communities, health professionals and policymakers all have a role to play. This week, I am encouraging every man to take one practical step for their health. I also want to encourage every organisation to consider one action they can take to better reach and support men. A good place to start is the Men's Health Forum in Ireland's website, mhfi.org, the HSC website, hsc.ie, or have a look for local supports in your area. Good luck to everyone involved, and remember, small steps taken together can make a lasting difference to the health of men, boys and all people in Ireland.
Thanks, Minister, for that. A really good word and a really good call out to the work being done and the opportunities we have to do more. And stepping out together is no bad idea. So, Minister Murnane O'Connor, thank you so much for taking time to be with us today with that call out. Just a reminder, Jean has already said it as well, that it's not too late to get involved in Men's Health Week. mhfi.org is where you go. The Minister's just said that there as well. And just also, Jean had said, I think already mentioned about the Q&A bar. If you'd wish to maybe make a comment or talk to us about something or ask a question, please do come on and ask the question, and we will come back to you in relation to that as the webinar goes along as well. Now, we're asking you to please stay with us because we have some really interesting people who are going to be with us. We've Dara Fleming, a poet that has a huge following out there in social media. We've Bobby Kerr, an entrepreneur, a radio broadcaster, and also a cancer survivor. We've Dave Smith, who's BOK Garage, who's going to be with us later on as well on the panel. We have Lewis Byrne, who's a social prescriber, and he's also a champion for screening in Ireland. And we've Blahin Casey, who's a HSE manager and also involved in national physical activity pathways. So we're going to have a really busy hour together, and we're asking you to please stay with us for that. But let's begin, because our first person today is Mr. Bobby Kerr. Now, Bobby Kerr is an Irish entrepreneur. He's a businessman. He was the chairman of Insomnia Coffee Company. You remember him from Dragon's Den on RT, probably back in 2009. And then in November 2015, Bobby was diagnosed, and he talked to us about the fact that he had a diagnosis for cancer. In his recovery, he's been very active in relation to promoting men's health nationally and beyond. Now, recently, Bobby sat down with Fergal Fox and they had a conversation around what he has learned on his journey into recovery, what's important in life, and what he wants to do now, I suppose, in relation to raising awareness of men's health on the island of Ireland. So please sit back, watch and listen. Wise words from a very good man.
Hello, Bobby Kerr. Thank you very much for joining us, and thank you so much for supporting Men's Health Week.
Delighted to be part of Men's Health Week, Fergal. It's great. It's a great initiative, and I think it's one that we need to get the message out there on. So I'm really happy to play my part in it, and hopefully by some of my examples and some of my thoughts might be useful to others.
Yeah, really appreciate you taking the time to support our webinar for Men's Health Week. And the key message, as many people watching will know, is one step at a time, progress, not perfection. How do you, what kind of thoughts does that conjure up for you when it comes to men's health?
Well, I'm 10 years clear now of, I had head and neck cancer in 2015. So I'm nearly 11 years clear. And it was a slow build, to be honest with you. Excuse me. So that's just the background. So I tried to start slow. I tried to start getting an exercise regime in, where I started walking, then I started running, then I ran. I got as far as a half marathon, but I built it up slowly over the years, and I try and have 2 or 3 pieces of activity going. So I run, but I only run for so many months of the year. I cycle, I sail, I walk. I try and do as many things just so I don't get bored. I go to the gym occasionally with some of my daughters. So I don't really I have a routine of doing, say, 3 things a week, but they could be 3 different things.
No, and was that always with you, or was that like following the recovery from cancer?
Well, I was always fairly active. I was a keen rugby player in my day. I've sailed competitively for 35 odd years. So, but running, cycling, basic fitness, I had kind of that slide.
And when it came to the recovery from the cancer, how did you find that you needed to bounce back from that?
Well, as I say, it was quite slow because I was very sick
Yeah.
and I was very weak. I'd lost a huge amount of weight, so I was kind of, it would really had to be literally getting up off the couch and walking a few yards was difficult at the start. But I just built it up week by week. And then I felt that I was able to do more and more. And I'd be honest and say, like in those early days, eating food wasn't a problem because I lost my appetite. But in more recent times, that's my greatest challenge, to be honest with you, is managing my diet. I still have a really sweet tooth. I like to cook. I like to eat. I like a few drinks. So I find that bit much more difficult to be good on rather than the exercise.
Men's Health team, one step at a time. Your recovery journey after cancer you had to take one step at a time and build up your capacity and physical ability to exercise.
Yeah, and that's literally what it was, one step at a time. And I think that's a message I'd give to people, that if you're unlucky enough to be dealt that blow of a serious illness, you start in a place, and all what my realization was once I got sick was that only three things in life actually mattered, and they were my health, my family, and my friends. So I kind of lived my life through that trio of importance, and I don't really care much about all the other stuff. It gives me a clarity of purpose. I live every day, with vigor, with energy, and I don't get involved in negativity or small stuff. It changed my outlook on life to be focused on those three things: health, family, and friends.
You would be well known to most people from your role as an entrepreneur and broadcaster, and from the television. But that's interesting that you say that your experience with a serious illness just brought it back to brass tacks, really, didn't it?
That's it. And because when we think about all the wasted time and energy around, getting involved in negative situations, looking to purchase things we don't need, it's life is actually quite simple if you strip it back and analyze it. And life's for living, and we need to live every day, not as if it's our last, but we need to live every day positively, I think. And I'm blessed with my family of girls. I'm married for nearly 40 years. I've 2 grandchildren now, and all those things they're hugely, hugely important to me.
And I'd like to ask you for a minute, just in terms of the advice around prevention of cancer and early diagnosis. Like, did you find out early, or how did that go for you?
Well, I was, and again, I'll put my hand up and say that I wasn't the best at looking after my own health. One of my daughters spotted a slight lump here on my neck and made an appointment in the doctor for me and said, "You're going to get that checked." And I didn't think there was anything there, and there was something there. So it was by somebody else's interest in my health that I actually. So what I'd say to people is, be conscious of your own body. Look, if you see something that's changing, that doesn't feel right, that doesn't look right, if you're tired, if you've got a constant cough, if you're losing weight for some odd reason, all those things are indicators that there could be something wrong. And I think if you go and get checked early, obviously you're in a better position in terms of getting better, because you present early, the medical people can do more for you. So that's one thing I'd say, is be self-aware of your own body. The second thing is, I go and get my bloods done once a year, and I get a cardio test and an angiogram once a year as well. Just those 2 things. So you check your heart and your bloods, and even if you did those 2 things and nothing else, I think you're on the way to making sure that you're in a preventative place rather than trying to deal with a cure.
The advice that I suppose the other advice that we give in terms of the prevention message is the HPV vaccination for boys, which is often linked to the throat cancer experience that you have, to encourage people.
And my form of throat cancer was related to the HPV. That was what I got.
Right.
So I was somebody who wasn't vaccinated and who actually got the HPV form of throat cancer.
Right. So that's just to highlight that for parents that
Yeah,
HPV
I think for
vaccination
parents
boys.
now, and particularly for young boys,
Yeah.
because when people think of the HPV vaccination, they're thinking about girls primarily, but boys need to be included in that, and boys need to get that vaccination as well.
Yeah. The other message that came in from our National Cancer Control Programme is around highlighting, we'd like to highlight at this Men's Health Week webinar, the bowel screening, that we need to increase the uptake for that. Yeah, that's
Correct.
right. Yeah.
And again, once it arrives in the post, I think it's a great service. It's something that I do meticulously when it arrives. You know, these things sometimes are easy not to do, but I just do it. And then I send it off, and then I wait, because it's another check along the list of preventative medicine. And I think it's a really, really good idea, particularly with something like bowel cancer. If they can be spotted, that if they can see that you've got blood somewhere where you shouldn't have it, again, it's an early warning, and prevention is way better than cure.
Yeah, and while smoking cessation is kind of really widely acknowledged as a preventive in relation to cancer, I think one of the things that we've been highlighting recently is the reduction in alcohol, that alcohol is, cancer causing as well. That's not widely enough appreciated in Irish society or other societies.
Yeah, well, and again, I'm someone who smoked in the early days. I haven't smoked for 30 odd years, but I was a smoker in my teens and into my 20s. I gave up when I first started having children. So I don't know, does that ever go away? The fact that you were a smoker, even though it was like, as I say, over 30 years ago. Alcohol as well, you need to be careful of. Again, I like a few beers. I like the odd glass of wine, but you got to be careful with stronger alcohol as well. Shots, spirits, like they're strong drinks, and your intake of them in terms of your living your life and getting out of bed and doing a day's work the next day, you need to just watch your levels of alcohol. Sometimes I've seen it with people sometimes where they just gradually increase their intake unbeknownst to themselves, and then all of a sudden they seem to have a problem, but that problem was building up over a number of years. And I think we need to be conscious about when we drink alcohol. It's a social thing. It's nice to do with friends, but if you find you're drinking by yourself, or you're drinking to get rid of worry, or you're drinking for reasons that aren't social, I think it's time to maybe have a look and see is all well here.
Yeah, that's a couple of interesting red flags there, Bobby. Thanks for sharing that. And thanks again for your support of Men's Health. In terms of the week, and is there any final message you'd like to give men and boys for the week ahead?
Okay, so for Men's Health Week, my key message would be to get yourself checked. Check your bloods once a year. Go and have your cardio checked also once a year. Get a bowel screening. There's 4 or 5 things you can do medically to make sure that you're in the preventative zone, minding yourself. Watch your body. Keep an eye on your body for things that may tell you that there's something wrong.
Okay, thanks very much, Bobby, for joining us on the webinar today.
You're very welcome, Fergal. Thank you.
There you have it, folks. Bobby Carr. What a brilliant interview, and what a wise and inspiring, heartfelt, empathetic recall of his journey back into wellness, and some really good information there given to us as well around the things we can do, especially in relation to being proactive around screening and support for ourselves in relation to our health and well-being. Bobby, thank you so much for that, and thanks, Fergal, for bringing us that interview to be here for International Men's Health Week. Now, what can I say about our next guest? There's so much we could say about Dara. Dara is a writer. He's a spoken word performer. He's an award-winning writer, and he's all over social media. Dara, you've such a following in relation to spoken word poetry. Your Thoughts Too Big blog has a huge following, and you've spoken very candidly about mental health and well-being and masculinities. And you're good enough to give us your time here today as well. So you're very, very welcome. Thank you for joining us to talk about your own work and especially masculinities, men and young men. Thank you so much.
Yeah, no, I'm delighted to be here. I think it's really important to talk about men's health in all the contexts and the role masculinity plays and just like manhood because a lot of men are struggling and feel disillusioned. So it's important to give space for these conversations.
Right. Well, we chatted just briefly before you came on here, and I was really interested in the thing. I often say it in relation to poetry, especially. You're bringing the spoken word part of poetry back alive for so many people that it's usually not a genre that people hang out in, and especially maybe men. So, what's the secret in relation to that, Dara? That feel there's something happening in the world that poetry is opening up again.
Yeah, it's been interesting, like, because I've been writing poetry for 12 years, and I suppose in the last, kind of since the end of the pandemic, there's been this kind of revival, not of poetry, but of interest in poetry, because poetry's always been tipping away in the background. But it's just become this thing that people are looking for and feel is probably more accessible through spoken word. So I think that's a lot to do with it. And then it's just giving people space to stop and take a breath and reflect, especially in a world that's so like information heavy and fast paced, that poetry is kind of an antithesis to that, I think. So there's a lot of things going on, but it is a great time for poetry. Poetry is back in a way.
Okay, well, will you show us why it's a great time for poetry before we have a conversation? Because I'd ask you, would you come on and maybe, people say, maybe some people know you, they're here today, but people might know you. Can you give us something that said, this is what I mean by poetry, and especially do so much around the lens of masculinities and positive masculinities? What would you
Yeah,
like to do for us to begin, and then we'll have a conversation?
yeah, sounds good. So I have a poem that I posted a few months ago. It's called Boys Will Be Boys, and it's just kind of reimagining that phrase because I think that phrase has justifiably some negative connotation with it. But this is my poem, Boys Will Be Boys. What if the phrase boys will be boys just meant that boys could be boys? Without all the noise and conditioned behavior, boys will be boys wouldn't grow legs, becoming a way to dismiss the pain they'd cause later. If we stop trying to influence their fate and just let them become, let them grow on their own and take their own shape, then maybe boys would be men who never abandoned the gentle child within them. Boys didn't have to hide that they sleep with a teddy at night or weren't told to man up every time that they cried. Then they wouldn't learn to perceive softness as weakness, wouldn't believe that anyone who expressed their emotions was a person beneath them. Instead, they might just see them, hear the emotions they're speaking, and maybe even feel them too. What if every boy grew into a person, their sense of self not perverted by rigid prescriptions of what it means to be a man, but instead they just showed up as they are? Then boys would be boys and girls would be girls and people would just be people. And I know it's not that easy, but it could be simple. Because dogma of how you can and can't be always finds its root to evil. So let's let our boys be boys and stop filling their heads with our distorted ideas of what it means to be men, because history would suggest that we haven't exactly nailed it yet. Sinead.
We haven't exactly nailed it yet. That is it, folks. I mean, that's what Dara does, and you're going to do it again for us later on. Dara, like, you're a young man. Can I say that? I'm an older man. You're a younger man. And I'm really fascinated by, we talk about men and finding and developing our emotional and expressive intelligence, Where does it start for a young man like you? Or what was it that led you into the conversation that became the sound of your poems?
Yeah, I mean, I suppose like in terms of poetry and just writing in general, it's always been part of me. Like as soon as I could read and write, I was obsessed with books and writing poetry and writing short stories. But that wasn't necessarily linked to mental health and my idea of what it means to be a man or a boy. Like, to an extent it was, I suppose, because to be into reading and poetry was seen as this kind of unboyish thing, especially in school. I went to all boys schools, and you kind of had to hide that you were into art or creativity because it was seen as like non-masculine, which in and itself is a problem. But I really kind of came to the mental health aspect of it because my best friend took his own life when I was 17. And Irby was this really like massive personality, and he was so fun to be around and very popular and outgoing. But he took his own life, and none of us knew he was struggling. And that was really scary, and it opened me up to this realization that like there's a lot of masking going on. There's a lot of people in pain who can't talk about it. And Irby is one of those people. So when I kind of recovered from my own depression 4 or 5 years later, that's when the investigating like men's relationship to mental health and emotion really became important to me, because I was terrified that what happened to Irby would potentially happen to me or someone else that I loved, and I knew how hard it was to get through someone taking their own life. So it really became important to me to like try and figure out or do my part in getting men to engage more with their emotions in a healthier way, so that when they are struggling, they can talk about it.
Dara, to lose a friend that you loved so young, and you mentioned the sentence after that when Herbie passed away, and you said 3 or 4 years before you kind of really started to look for the supports that you needed in relation to depression. Why was it so long for you, do you think? Or why is it so long for us as men, out of sadness and loss, that we don't get to where we need to be maybe in relation to finding those resources and supports?
Yeah, no, it's a good question. There's a lot of factors in place. One, I think I didn't know I was depressed, because this is 2012, 2013 when it started manifesting, but I didn't really like, there was no mental health education or mental health awareness, not to the same extent that there is today. So I didn't even know really what depression was. My idea of depression was that you were just constantly sad all the time, and that wasn't my experience. I was actually experiencing numbness more than anything. So I just thought that was normal for an adult. Like, oh, adults don't feel emotions, because if I was depressed, I'd be sad all the time. So that was one thing. But then when I realized that I might have depression, the main barriers there were stigma, both societal stigma and self-stigma. So at the time when I was 20, 21, I believed that having a mental illness or being depressed meant there was something wrong with me and that I'd failed, and that people would look at me differently, and family and friends would stop loving me in the same way. So I rejected the idea that I had depression based on this stigma, even though I definitely had it. I was like, no, I'm not struggling. I'm fine. I'm going to push it down and keep trucking on, which is a very like almost a cliche at this point of how men deal with emotion and mental health struggle, where it's like you just kind of grin and bear it and push through, because the idea of like asking for help is harder than that, which, as we know, isn't true. But that's what we're kind of led to believe, or we're conditioned to believe. And then eventually it got to a point where it was getting scary and potentially dangerous, that I was like, I need to take my kind of pride out of this and my concept of what it is to be a man and ask for help. And I did. And none of the things I was afraid of happening, like people distancing themselves from me or thinking different of me, none of that happened.
Yeah.
People who loved me just wanted me to be okay and wanted to support me. So there's a lot of like false storytelling going on when it comes to how men relate to mental health, and this idea of like needing help being some sort of flaw or weakness, when in reality we're human beings, and human beings are inherently imperfect and inherently like, we're not islands. We need people. We need each other. That's what it is to be human. It's to be connected. So this idea that men can like carry the burden alone is false and dangerous.
And tell me, you're a very intuitive and sensitive man, right? So in your learning and what you've said, and we've already heard Bobby there a few moments ago as an older man as well, talking about what he's learned in his recovery and staying well. What can we do more of in relation to, providing a holding space for men, or a calling space for men in relation to getting supports, normalizing conversations? Where's the space for that, or what can we do more of in your experience? And you have a lot of experience. You've spoken fairly candidly about this.
Yeah, there's so much we can do. I think something that I keep coming back to is, especially when it comes to emotion and men engaging with an emotional life, we've been very good thus far at encouraging men to do so, to speak if you need to talk. One issue I have that, and it's just a language thing, that we're always encouraging the person who's struggling to talk. Like, oh, I'm here if you need to talk, reach out to me if I need to talk. And I actually think it's the responsibility of those men who aren't struggling, or who aren't struggling to the same degree, to start the conversations. Because when I had depression, the hardest thing to do was to talk about it, to start that conversation off my own bat. But if someone came to me and they started the conversation about mental health, or how they were struggling, or they've struggled in the past, that was more accessible then, because they've been like, oh, we can talk about this here. So you've given me like the green light to be able to talk about it. But if I'm generating that conversation myself, that's really hard. So I think we just need to change how we talk about that, rather than saying, reach out if you need to talk. Take the responsibility of being the person who starts that conversation. Does that make sense? And then on the back of that, I think, because we're changing generations of conditioning and societal expectation in terms of how men relate to emotion, I think the biggest thing men need right now is patience, and the space to figure it out, because it's not going to happen overnight. This change in the relationship with emotion, it's going to take time, and it's going to take, trailblazers. And you see, like your Brezzies, your Blind Boys, men who are like stepping out and like leading the way, and then that causes like ripple effects. It'll just happen over time. And I think, the generation growing up now will have a markedly different relationship to emotions than the generations that came before them. And I think that's brilliant. So it's just that patience that's needed.
Okay, poetry can feel like it's quite individualistic and quite isolating, but in your way, in the spoken word poetry, you bring it to forum. So you found a community through it. How important is that? The spoken word builds community. And for yourself, Heaney says, I rhyme to see myself, to set the darkness echoing. Was that your experience, that in rhyming you find who you are becoming?
Yeah, and it's interesting how the poetry changes over time, because when I was struggling, and even to this day when I am struggling with mental health, the poetry tends to be about the self and how I'm dealing with what's going on. But when I'm in a good place, it is more collective and more connection based. And the reason I think I lean towards that is because, one, I suppose I wasn't growing up the traditional expectation of a boy. Like, I wasn't like hyper masculine, really into sport, like being outside, like playing in the dirt, fixing cars with my dad. Like, I wasn't that boy. I was quiet and introspective and sensitive. So I always felt a little bit outside of what the groups I was in. And then as I grew up, and you grew up with the internet, we're all so connected online, but it's kind of not real connection, because we're connected with thousands of people, but we're on our own physically.
Yes.
So there's this kind of lack of connection that felt familiar. So a lot of my poetry is actually about finding our way back to connection, both with ourselves and with the people around us, and having that true connection with people. So that will naturally invite community, because I'm looking for connection through the work, that other people who are also looking for connection will come to that place.
Very good. Tell me this, your map to wellness and staying well. You're very clear on things that you've learned, and I've seen that before in some of your blogs. What is your map to wellness for somebody that's looking in, and maybe a young man or or a man himself and he's looking in today and say, what have you learned about wellness and the map to wellness for Dara that kind of keeps the stability as best it can be in your life in staying well? What are the primers for that?
I think a big thing I learned in my mid-20s was like actually maintaining the relationship I have with myself and like really knowing who I am. And by that I mean like knowing what I like, what I dislike, what I want, what I need, how sometimes what I want is different to what I need. Like, and a good example I use for that is like I almost never want to go to the dentist, but I often need to go to the dentist. And
Right.
like sometimes the things we need for our well-being aren't necessarily things we want to do. Like I often don't want to go for a run or go to the gym, or sometimes I want to stay up late when I really need to go to sleep. There's things we like, there's a certain amount of like discipline or kind of like, being a parent to yourself, if that makes sense, that needs to happen.
Absolutely.
But ultimately it's about that like awareness piece. And I remember for years I used to have a sticky note on my monitor that just said, why have I reacted this way? Because often like we'll react with a certain emotion and we won't dig into why that emotion's come up. Like a good example would be like something I might have seen something that really like angered me online, and then the
Yeah.
next person who comes into the room gets the brunt of that annoyance and it's projected at the next person, but it's actually nothing to do with them. And if you don't investigate that, that behavior can continue. And every time you're annoyed at something else, you're putting it on potentially someone you love, and that can be really like toxic. So it's like having that awareness around your well-being and like seeing what you need. Like often I'll be like, I'm really anxious today, and then I'll realize it's because I've been only getting like 5 or 6 hours of sleep for the last 4 nights. But
Yes.
it's having that awareness of like how I'm feeling and how my behavior is affecting that emotional landscape. So like often and like this is good because it shows what's in your control. So maybe I'm in a bad mood because I haven't been looking after myself, but maybe I'm in a low mood because of something else that's going on. And if I can look at all the stuff that I have in my control and feel like I'm doing as much as I can and I'm still not feeling right, then that kind of tells me that maybe I need to go back to therapy or check in with my GP and connect to support. So it is about that kind of awareness and having that relationship with yourself. Because I think like it's funny, like we don't really talk a lot about the relationship with self. But for me, it's the same as like making a new friend. And in
Yeah.
order to get to know someone, I need to ask questions and I need to know the answers to those questions. So I think it's very much the same with ourselves.
Get to know thyself, as to say, the wisdom of that. We're running on time, Dara. There's a few things I still want to just ask. I know you're going to come back to us just before we finish. Sometimes we associate mentoring with older, wiser, but you're a trailblazer and you're also a mentor. You're mentoring so many people in relation to health and well-being and mental health. You're specifically around positive masculinities and mental health. For yourself, was there significant people when you think about, especially in masculinities, were there people that threw the light switch that you met along the way and said, okay, I think differently because I met this person? And how important do you feel mentors are in our lives as men, especially in younger men?
Yeah, no, definitely. Like, I mean, first and foremost, my dad has always been a really great role model. Like he hit me with the um you should always do the right thing, even if it's not easy, like quite early. Like he hit me with that knowledge pretty early in life. And that was like that's kind of like really shaped a lot of my life. But then in terms of like role models, like in a broader sense, I've always been drawn to men who don't fit the mold of like expected manhood. So like that they're not these like traditionally masculine like what we think of traditional masculinity, that they're kind of outside that mold and still like very comfortable with their manhood and their masculinity. And people like that would be like Andrew Porter, Brezzy, Blind Boy.
Yeah.
We've already mentioned like these people are like they're all men, but they're men in their own right. And I think that is such a good message to send to young boys, that like no matter how you show up in this world, that's what it is to be a man for you. And that's completely valid. I think that's a really important message to come through. And I think it's coming through more and more as time goes on. So they're always the men I kind of drawn to, I suppose.
We good. Darren, I'm going to have to let you go because of time on us, but I'm bringing you back before we go out of here today for another poem. You're a remarkable man, a remarkable young man. Your poetry is amazing. And I'm saying to people, we'll put it in the line. If you haven't met with Dara yet and the spoken word and his poetry, please do and go and have a look, because you're such an ambassador for all that is good and aspirational for us as men and younger men especially. It's just gorgeous talking to you. We'll see you soon.
Thank you, Lorcan.
Thank you very much. That is Dara Fleming, folks, and do go and look for Dara if you haven't found him already. He brought a tear to Miriam O'Callaghan's eye recently on an interview with her as well. Just amazing, amazing young man and there. So look, we're caught on time. We're moving along fairly lively here to get through a number of things in our webinar. Before we go to our panel discussion, which we're going to do now in a few moments' time, can we have a short look at a video that reminds us why we're here for Men's Health Week in the first place? There we are, folks, having a little bit of tech trouble coming back onto you. But that's why we're here, folks. And one step at a time, progress, not perfection, is what we're about. Being joined by a number of people here now who have been good enough to come and be with us for Men's Health Week. And I'm going to introduce them to you here. It's Lewis Byrne. Lewis is there on the bottom of my screen anyway. Lewis is a social prescriber and is a link worker. And he has a really, really good knowledge of working within the community and the services that he brings to youth especially. He's an avid advocate for the role of physical activity, and he's very, very strong in relation to health and well-being. You're also a trained advocate for national screening, Lewis, and we're going to talk a little bit about that here as well for a while. We have Bláithín Casey here with us, and Bláithín is a physiotherapist by background with a PhD in physical activity. She's project manager in the Healthy Eating, Active Healthy Living programme with the Health and Wellbeing Division of the HSE. And her remit is the development and implementation of the National Physical Activity Pathways Health Services. Bláithín, is lovely you're here with us as well. And then we also have Dave Smith and BOK Garage. BOK Garage is a really super initiative, Dave, that you've been very much at the heart of working with men in relation to positive mental health and through your own recovery story. So it's absolutely fabulous to have you all here with us today for the next 15 to 20 minutes or so. Can I begin by saying, Lewis, I want to bring you in here, another young man on the screen. We've just had Dara, which is quite amazing. He's still going around in my head and my heart here as I'm moving into the next part of the webinar. Lewis, yourself, you're in the community and you're working as a social prescriber. Social prescribing is relatively new, and it's a new link between the services and the community. For yourself and your engagement with men, and younger men especially, what are you finding? Are you finding in social prescribing it is really helpful and supportive in relation to linking with men and naming some of the issues that we've already talked about here today?
Yeah, and thanks for having me as well, Lorcan, on the webinar, and happy Men's Health Week too. Social prescribing is a relatively new program. I've been working as a social prescriber in Dublin's Northeast Inner City for the last 5 years with Dublin City Community Co-op, one of our healthy community sites here in the Northeast Inner City. And what social prescribing is, for some of the people in the webinar that may not know, it's a very personal, it's very human, it's a very bespoke service to connect people with their communities. When I first began working as a social prescribing link worker, it was just at the sort of middle of COVID, where and coming towards the end, where people were really isolated. A lot of services, a lot of organizations in the inner city and nationwide would have been closed for a long time. So we really found that when people were transitioning back, there was a lot of social isolation there. So yeah, social prescribing, sorry, works really well to get people connected, whether they want to develop a new skill, find a new hobby, or just meet new people. We're sort of the link there to get people back active and back, engaging with their own communities.
Very good. And Blahin, when you hear Lewis talking there, because a lot of the work that you're involved with now nationally, and we mentioned this before when we were chatting, has to do with pathways, hasn't it? And I know the HSE are very proactive now in relation, making the links with signposting and supports. Can you say a little bit about that in your own role, especially, which I think is a very important cultural shift that's going on in relation to HSE?
Yeah, exactly. And I suppose when we think about those pathways and why we want to have those pathways in the health service related specifically to physical activity is my remit. So we know that over 50% of men aren't physically active enough to meet our national physical activity guidelines. Despite, I suppose, the benefits, whether that be the immediate benefits that you might get from a short burst of activity. So things like, we all know if it's hard to get yourself out, but when you get out, you can feel the immediate boost in your mood. There's also evidence around that lowering blood pressure in that immediate short-term piece as well, insulin sensitivity and all of the rest. And that's not to mention all of the long-term benefits of being physically active. But as I mentioned, the majority of the population, that's not unique to men. It's the same in females. Aren't physically active enough. And I suppose the healthcare system is one of many places and spaces where the conversation around physical activity can come up. But in the healthcare system, there is an opportunity when a man is presenting we use the example of general practice to kind of make every contact count, and that's a national framework that we have in our health service. And I know it's hard for we don't see men present in the healthcare system around kind of preventative health. So it might be that they're presenting for an acute illness. They have something that isn't going away and kind of do need to turn up into the GP to get the antibiotic and the script. But maybe there's an opportunity in that conversation to raise the topic around health behaviors, and physical activity is one of those. Could be smoking, could be diet, alcohol, drugs. But in terms of physical activity and that pathway space, it's knowing that, especially for the behavior of physical activity, that up to 95% of people, whether you're living with a chronic disease or not, are safe to be active outside of the health service. We all know the pressure and the burden the health service is on as well at the minute. And again, encouraging kind of pathways and signposting outside of the acute services. So when we speak about physical activity pathways, I suppose that's what we speak to. I suppose signposting, if someone is open to wanting to become more active, if they're not currently active, how can we as healthcare professionals signpost and provide pathways for them to be active in their community? And through healthcare professional activators and implementators like the social prescribers in Lewis's roles, they help carve out those pathways and directions as well. So
wow, that is a really good change. And 95%, as you say, with clinical with issues can still be very safely active with it, which is a really good news story. It's a good news.
Exactly. There's very few reasons why someone can't be active. Again, there's subtle definitions in the definition between exercise and structured exercise to a certain intensity versus general movement. But exercise is safe, and we know that most people can be active outside of I can say as a physio eyes or healthcare professional eyes watching them.
Yeah.
So
Yeah. Wow. Very good.
Yeah.
Dave, Blahing's just talked about something called making every contact count. In your Be OK Garage, a super initiative based on your own recovery in relation to mental health, bringing men together and making those contacts count in a different way. You know, what have you found, or what are you finding in relation to the work that you're doing in your volunteer capacity, especially with men, in relation to working together side by side in some passionate, at the heart of what you're talking about, but normalizing conversations?
Yeah, I think that normalizing conversations piece, Lorcan, is very important, and that's one of the things I try to champion as much as I possibly can. Be OK Garage started as me just working on cars, modifying cars, and I struggled for a very long time, both knowingly and unknowingly, with my mental health, and I finally got my hands around it, and it took a long time, and it's a constant management piece. And I just said to myself, it's very difficult to approach the subject with people. I think that, you know, Dara touched on that earlier on, and there's still quite a lot of stigma around you know, suffering with your mental health. And I just want to, on one hand, show people very cool cars, and on the other hand, talk about not being okay and the services that you can have, and just removing the stigma about it.
It's a remarkable initiative you have. Lewis, I was going to, when Dave mentioned it, and I was going to mention it to you as well, are you finding stigma as well? Is that still very strong for demographics of men in relation to not wanting to go to a service? I'm sure Blahin is understanding of this as well. What's your own experience, Lewis, in the community? Is it still there, or is it shifting, whereas men we can feel we can ask for support if we need it?
I feel like that there is a strong silent type persona still in male communities. And one of the programs that we deliver, which is a men's health program, looking at men's health and well-being through the lens of a man. We have an activity called It'll Be Grand, and I think with the Irish culture as well, we have a awful habit of saying it'll be grand to a lot of things, you know, and putting things on the back burner. So just for example, with that activity that we do with groups of men, we'll list up a couple of different symptoms to an overarching health issue, and we'll let them guess what that could be, and ask them would they go to their GP if they had so and so symptom. And that opens the discussion and the conversation a little bit more to, you know, make a bit more of a note of something, and maybe something is an issue, and maybe something needs to be checked sooner rather than later. So I think it's a little bit in male culture and a little bit in the Irish culture as well, that we do have a bit of a habit of saying it'll be grand a little bit too often.
Yeah, and Blahin, you know, Bobby said it earlier on in his interview with Fergal, you know, around the importance for the screening. And I know Lewis is a champion in relation to the diabetic retina screening and the bowel screening. We'll put those up there because we want more men to use these services. But for yourself as well, you know these figures, Blahin, it's a challenge. We're not using some of the services, some of the initiatives and programs. What do you think we can do about that? You know, have you any, it's an unfair question maybe, but
yeah.
Insights?
I instead was going to give my examples of more evidence of that, and maybe put the question back to yourself, Dave, and Lewis. I suppose just what I mean by the evidence we have recently. So we launched at the beginning of April a free 10-week physical activity behavior change program through the HSE app. It's called Get Active. And it's gone really well. Lots of sign-ups, but we can see a significant gender gap in sign-ups already since the start of April, with kind of a ratio of 80% female to 20% male. Like, why that is stark. It's really stark seeing that gender gap difference, but it's well documented in the evidence around these. I suppose these proactive health promotion type of programs. Now I might have some answers for you specifically to that physical activity program space in a couple of months down the line. We've commissioned a piece of research where we'll have a 50-50 split between male and female going through the program, maybe to explore with male participants more around that. But it's definitely something we see in those health promotion type of programs. But the good news, some good news, the Irish Sports Monitor published their recent report last month. And in terms of like gender gaps in physical activity levels and that, we don't tend to see big gaps between, let's say, male and female, with men kind of having higher rates of activity in that kind of social participation space, in whether that be kind of clubs or volunteering or attending kind of sporting events, and that kind of sporting, that's kind of with the sporting caveat in it. But definitely, and Lewis, you probably see that, I'd imagine, in those health promotion type of programs, the struggle to recruit male participants and that gender gap as well.
And Dave, just in relation to what Blahin's saying, your experience, not everybody's into cars, not everybody's like in that. I don't know much about my own car, but people who are passionate, is some of the key finding the things that men are passionate about and building service and conversation around those things. Is that your experience in the OK Garage?
Yeah, I think so. I started off by building like movie cars. So it was a tribute to cars from the Fast and Furious, because, as you said, not everybody is mechanically inclined or would really have much interest in seeing someone take an engine out or put an engine in. But everyone thinks the Fast and Furious was a cool movie because at the time it was. So to see like one of those cars on the Irish roads was very cool. And I'm currently 18 months into building my second one that was supposed to take 2 weeks. But I think it's the people are happy with a sense of community sometimes as well. I noticed I'm nearly 40, and when I was younger, the car scene can be a little bit exclusive, and they can have walls up. You have a certain type of car, maybe a Japanese car, a German car, an expensive car, a cheap car, and people don't want one to mix with the other. And I had thought to myself, that's crazy, like if people are into cars or people are into the scene, the more the merrier. We have BOK meets where there's young lads on scooters that come, and they're some of the best photographers you'll ever meet in your life. They can just get these angles and this perspective on your cars. So it's that kind of openness to bring people in and let them meet at our events. It's meet the friends you haven't made yet. And there's a huge, it works quite well. And I do a talk at the top of everything about mental health, because I know Dara touched on it earlier on about removing the stigmas. I will talk at length to anybody about my own mental health, my own journey, and I will normalize it, and I will continue to normalize it while there's air in my lungs, because I remember I had one very light bulb moment at a party, and I was sober at the time, and I was talking to a girl, and she asked if I was drinking beer, because I was drinking a can of fizzy water. And I said, no, I don't drink anymore. I'm actually on antidepressants as part of my recovery. And she just looked at me and she whispered, she said, did you say? I said, yeah. And she goes, I am too. And I said, it doesn't need to be a secret. And we had a really lovely, candid conversation. And it was just that moment of, some people feel that it's something to hide and be ashamed of, and it's absolutely not. If you had a chest infection, you'd be on an antibiotic. If you had a broken arm, you'd be in a cast. So, there's things out there, and there's resources to become, just a happier version of yourself.
Dave, that's so well said. I'm just conscious of time, folks. We're coming into land in a few moments' time. Just building on what you've said, Dave, and just maybe for Men's Health Week, the normalization, you've spoken about it, you're doing it so well. Lewis, what's your call out for men on the island of Ireland for the week that's in it, as we come into land here today? What's your hope for all of us? If I was to give you a word.
One word.
Not word, but give us a sentence.
I think a really important thing that we as men can do is find something to challenge us. whether it be big or small. It could be running a 5K, it could be spending 5 minutes in the sea, or it could be reading 5 books. But do something that takes you out of your comfort zone and really challenge yourself, because I think a man with a mission is a really powerful thing.
Man with a mission is a powerful thing. Blocking yourself in relation to the work you're involved in, which is really amazing work at the moment.
Yeah, so I suppose I'll come back to the stat I opened with, that more than 50% of men, that increases to 60% over the age of 55, aren't active enough to meet our national physical activity guidelines that are every move counts is the tagline. If you're on this call or listening in afterwards and you're sitting in that percentage, I suppose the first thing to know, you're not alone, because the majority of people are currently not active enough to kind of meet our national physical activity guidelines, and that you can make a start. The guidelines are guidelines. You don't need to start today to meet the guidelines tomorrow. You can start by using our tagline that every move counts, one step at a time. And actually, the most benefits are there for people who go from kind of being in that sedentary, not active space to doing a little bit more. If today, tomorrow, you can add even 5 minutes of that kind of moderate paced activity to your day. It doesn't have to be a 5K. It doesn't have to be a 30-40 minute walk today or tomorrow. You're already on the track for improving your health, and lots of evidence around that. So every move counts, and yeah, that one step at a time theme I think really fits.
Okay, and for yourself, Dave, that's good advice from Blahin and Lewis. One sentence as well. What do you think? The call out from yourself and your own experience.
I think to build on what Lewis and Blahin said, is I would like to just check in with people and talk to them, and also listen to them if they have something to say. I think that silence can be deadly, and it's okay to talk, and it's okay to not be okay, but help is out there.
Help is out there. Wow, well done. Thank you so much, folks. Thanks, Lewis, and thanks, Dave, and thanks, Blahin, for being with us today. We're coming up to the last part of our webinar for today, folks, but I did say I wanted to bring Dara back to me, and he is going to come back here just to bring us into land just after 1 o'clock. Worth staying for the few extra moments, folks. Dara, aspirations and hopes for us as we come into the week and for International Men's Health Week. What would you like to say to us in one of your spoken word poems then, in relation to what it is our hope is and our aspiration? Can you give us something there, please?
Yeah, for sure. And I think this poem is the ultimate aspiration. I wrote it in response to Lucas Jones, and it's called If I Ever Have Boys. If I ever have boys, they'll be dangerous men. They'll smile at dogs and children and be a tonic to friends. They'll send flowers to their mother just because, and they'll be a shoulder for many when the world is too much. My boys will know that vulnerability is strength. They won't bottle anger, they'll learn how to express. They won't let pride be the reason they hide wearing masks while they're hurting inside. And my boys will be dangerous men. They won't stay silent even when it's uncomfortable for them. They'll learn that their actions are more effective than words, but they'll use their voices to amplify the unheard. They'll know that love isn't something to perform, and they'll see beauty in all of its forms. My boys won't go learning to emotionally hide. They'll reshape masculinity into something they like, make it softer to touch. They'll know that who they are is more than enough. They'll know that being a man doesn't mean carrying the burden alone, and they'll learn that an emotional man is a man fully grown. They won't settle everything with violent swings, and they'll live in truth even when that truth stings. So yeah, if I ever have boys, they'll be dangerous men. But the danger they'll be won't be the one society meant. Here we go.
That's powerful. Thank you so much, Dara, for landing the webinar for us and wishing us well into the week ahead. Folks, thanks everybody for being with us today. Thank you everybody who makes this happen, to Jean in the background there, to Michael on the screen with me, to all the people who make it happen, and to yourselves as well. It's still not too late to get involved in the week. mhfi.org. Do something to mark the week. And until we see you again, let's mind ourselves, let's mind each other, let's mind our lives. Thank you so much, everybody.